record, right?
Oh,
Start recording. Hello again. You are with our Senior and Disability Services information sharing session for providers. And I'm sharing the screen that contains our agenda today. Um, Again, we want to welcome you. We do have a few things that we've been getting a lot of questions about. Um, doesn't mean you can't ask your own questions, but we did want to shed some light on the following topics: cost of care, which is also called cost of care amount, which is one of our more fun acronyms, COCA, cost of care amount. Um, we have some communication guidance for our long-term care unit within Division of Public Assistance, which we can send to you. Um, as always, we record these sessions and we put them up on our YouTube channel. And everybody who attends can get a copy of the materials that we send out. We have your email because you're in attendance, and we'll send them out to you. So you'll get this, and you'll get a copy of the communication guidance, and you'll have also a copy of down down the bottom here to a new class schedule for Alaska Training Cooperative. And just when we get to the reminders part, and you'll have a copy of the document that I'm going to go by to share with you 15 things to know about cost of care. So cost of care amount is is an interesting topic. It is money that some of our Medicaid waiver recipients, only waiver recipients, and that includes people who have CFC and waiver, or for that matter, PCS and waiver. As long as they have waiver, a person could a person could potentially owe a cost of care amount, a COCA. If the person lives in a licensed assisted living home and they get one of the services in their waiver from that home, like residential supported living or group home, family hab, they are required to pay their COCA to that provider. And the COCA regulations are here. It's very, uh, it's pretty comprehensive. It falls under DPA's responsibilities, and that means Division of Public Assistance. Division of Public Assistance, every state that administers Medicaid must have a cost of care process. It's called post eligibility treatment of income, or post eligibility review that DPA does to determine a cost of care. We do have I have more materials in just a second, but there is a webinar on our YouTube channel about cost of care, which you could access by that link. Don't worry about clicking on it now. When you get your agenda sent to you, there'll be the link to it available to you. Our I'll talk about this in a minute, the acceptance and management of residents' money and the COCA provider education. All right, I just want to give you a few more resources before we get into that. But a person could potentially not be living in a residence, getting waiver services, and yet they may still have a COCA, cost of care, and they would pay that cost of care to the largest provider in their waiver. All right, I'm going to call up a separate document to learn about cost of care, learn a little bit more about it. Let me share it. 15 things to know about cost of care. And I'm going to pull it over so I can see it too. All right. This is just what I'm going to go by to talk about this. Um, Hopefully it's big enough for you to see. I'll make it a little bigger. Okay, 15 things to know about COCA. One of the most recent things to know is that the AADD, Alaska Association on Developmental Disabilities, is leading a work group to research COCA and its history and communications over the years. The purpose is to eventually make a comprehensive written guidance, meaning like a booklet or a brochure, for people and families who may, get a COCA amount, and so they know what it is, and for providers. And all of the state divisions which are involved with COCA determination or have taught COCA for years and years, as we have, like our DPA partners and our Division of Healthcare Services partners and SDS. So we're all on it together with the director of AADD. So be on the lookout for that. It's quite the quite the complicated topic, but we're going to work on it and we're going to get something written out to people so it's a little bit more clearer, hopefully. So there's that. So how do people get the word? How do providers specifically get the word of cost of care that one is owed? Well, the person doesn't have this listed here, but it is about how do we know about COCA? The person receives a letter from DPA and they receive it a month before COCA is due and it tells them how much. And they when it ends, they'll get another letter that says stop paying next month. So the person needs to pay until they get another letter saying that they will not pay it, and they'll pay the COCA amount to their waiver provider. If they have a home, meaning residential services in a home, a licensed assisted living facility, the facility will also get a letter. The care coordinator will get a letter too. And that depends on because the crossroad here is DPA. So as long as DPA has current information, they can send these letters to all the parties that are helping that person. If they don't have current information, then, it'll go out to the wrong one or it just won't go out at all. So best thought here is to work with the care coordinator to make sure that DPA is updated as to where the person lives and, who is the care coordinator. That'll bring us to one of our topics in a little bit, our release of information for DPA. But so there's that. That's how people know. Okay, people affected. Providers are expected to read what we call RA messages that are on MedicaidAlaska.com. And I'm going to see if I have this website ready, and I'm going to skip over to that, stop sharing, and then I'm going to skip over to this web page, which is off of MedicaidAlaska.com. As you can see, once you go to it, I guess if you look on the top, you can see, it's sort of looks like MedicaidAlaska.com, but that's what it is. But there is a tab called RA Messages, and this is remittance advice. That's what RA stands for. Now, it's interesting because MedicaidAlaska.com works with all providers who are billing Medicaid. So that means pharmacy, psychiatric, surgery, doctors. Many of these things will not pertain to you as a provider of waiver services, but sometimes they do. So we advise to look at this at least once a week and check the latest ones. As you can see, 3/11, 2025 was a message, the newest message. Did that have to do with your work? Probably not, because you're not a diagnosis-related group facility. Um, Electronic visit verification, maybe if your agency does PCA, PCS, maybe. Introducing the Medicaid Provider Support Team. Now, that would be a really good one to look at. That would be where, if you're a provider, there may be a listing there that has, hey, if you're doing long-term services and supports in the community like PCS, group home, all those guys, that might be a good one for you to look at. They do announce trainings, and I'm not going to go through all these, but I'm going to go all the way down to 2023 because today we're talking about COCA, and there's two here from 2023, cost of care amount collection process and cost of care amount collection process for the ALH and SNF, which is skilled nursing facility. So here we have our acronyms that are interesting and always there. So your cost of care amount collection process, just plain, that's when the provider is not an assisted living home. That explains, I'll click on it, and I'll probably have to reshare what it says, and that's okay. It says remittance advice message, or a RAM as they call it. This is for a home and community-based agency or environmental modifications or a care coordinator. Cost of care collection process. You collect the cost of care, the COCA, from recipients who are required to pay it. Then you reduce your claim by the amount you got from the person, and you will be paid on your claim the difference. So you really get the same amount for the unit you provided, or units, as the case may be. But your part of it was a copay, was COCA copay. So there's that. And there are billing instructions attached, which I could also click on. I'm not going to click on it right now, but I do want to call attention to the contact person at DPA, because remember, this is not an SDS. We interact a lot. We're partners in this, but DPA is the main resource around this. And there is a contact, and her name is Jana Atonio, jana.atonio@alaska.gov, or you can call her. She is the contact for when you, the provider, have questions about COCA. Okay, so this is the type of interesting, useful information that you would get from your RA messages. And they're still up there today. They're still available to you. We do have that link in the agenda, or I'll just make sure there's a link there for you to follow if you want to check out RA messages. But we recommend, that you get into the habit of checking those RA messages. So I'm going to go back to 15 things to know about COCA. And let me find my share again. We'll get to it. 15 things to know. All right, here we were. So we talked about remittance advice, and we talked about JANA. COCA is required by law. We said that. COCA is determined by DPA. We said that too. For our discussion, COCA applies to waiver recipients and waiver services, not PCS or CFC PCS only. People who do reside in a nursing facility do have a cost of care, but they're not waiver recipients. So like for today's discussion, we're not going to get that far into the weeds. PCS and CFC PCS, the services that are within CFC, those are all paid through regular Medicaid, not waiver Medicaid. COCA is applicable to services and providers who are certified and enrolled in on a support plan and providing waiver services to the person. Some of our agencies do it all. They do PCS, they do CFC, and waiver. So it's not entirely accurate to say, if you're providing CFC, you don't collect a COCA. If you're providing CFC and you provide waiver, perhaps you will collect COCA from somebody who has you on their plan of care. So, but just know that CFC and PCS doesn't come under the COCA obligation. It's for waiver services. Okay, if they live in a home, we do get the question a lot. What if a person refuses to pay the COCA? The biggest answer, best answer I can give is that the person risks becoming ineligible for Medicaid because they're over income for Medicaid. And the cost of care amount calculation has to do with DPA analyzing their benefit income versus what they call a personal needs allowance found in regulation, which is the maximum amount of money a person uses to pay things they need, like a room and board, or perhaps other expenses if they don't live in a home, charging them room and board. DPA analyzes people's income. So they also know that the person has a waiver because they've reviewed their case when their waiver started. And they're like, okay, the person has a waiver. They have nursing facility or intermediate care facility level of care. They have a little bit too much money, or maybe a lot for a little while, too much money coming in for to be staying on Medicaid. What we're going to do is have them pay their cost of care, and then they keep their long-term services and supports, meaning the waiver. If they don't pay it, they risk becoming over income. And that means that they're not eligible for Medicaid anymore, so they won't have a waiver because you have to have Medicaid before you have a waiver. COCA must be paid only to a waiver provider. If they live in the facility, a licensed assisted living home, they pay that home. If they don't get the waiver residential, they can choose which waiver provider to pay. They should choose the largest waiver provider of services in their plan, even if they have a plan that only has care coordination. There are a few folks that only have care coordination on their plan. The COCA amount cannot be paid for regular medical expenses like eyeglasses, medications, prosthetics, PCA care, things like that. That's all regular Medicaid. Provider must report the amount they receive on their billing. And for instructions on that, there's the RA advice we just showed with links to instructions. And then your constant resource is going to be Jana Atonio. She can explain these things to you and your agency. COGA is usually time limited. It's usually not forever. People, sometimes don't understand what that is, the person, the recipient, the resident. It just has to do with an analysis of their income, and it's okay to pay it, and they should pay it because they must pay it because they risk Medicaid ineligibility otherwise. If they have we do get questions of what if the person has an extremely high cost of care amount, like so high that they can't pay their room and board, right? This is where I say the best answer is to contact their DPA caseworker. Now, the caseworker is going to be on the letter they got that says you owe a cost of care. The caseworker is going to be on that letter. They should contact the caseworker. That way, they can report different kinds of expenses they may have that may reduce their cost of care. For example, out-of-pocket medical expenses and other kinds of allowed what they call deductions to their cost of care. That is what DPA does. They determine all that. They may lower their cost of care or possibly eliminate it. There might be something happening with that. But the caseworker must do it. And then the long-term care contacts we're going to give you on a paper, that long-term care DPA contacts. This lists their current caseworkers. And if the person got one of the very special letters from DPA that says you have a new caseworker, but your caseworker but you don't have a caseworker. Sometimes people get letters like that. It says, hey, your caseworker is changing. You don't have one. Well, there's an option on that document for what to do if somebody doesn't have a current caseworker. So there's always a way to contact, and there's always something to do or know or learn about cost of care. Last but not least is number 15. A person could consider applying for a different form of Medicaid besides long-term care Medicaid, depending on their circumstances. If they have a different kind of Medicaid, they're still going to be eligible for the waiver. There's a few forms of Medicaid that work very well with waivers, and I can think of one example, working disabled Medicaid. If a person is working, they can apply for working disabled Medicaid, and it has different rules of income, amounts in the bank, and things like that than long-term care Medicaid. So maybe if the person is working and they have a high cost of care and it's not able to be reduced by any deductions and they have a job, they could explore working disabled Medicaid. Now, who can tell them about that? Their DPA caseworker can explain different forms of Medicaid. They can't tell a person what to do. They don't do that. The person has to decide, or their representative, somebody who's helping them with their case. They need to, decide. The person needs to decide. But a worker at DPA or a state worker or even a care coordinator or anybody else, giving services to that person, we don't tell the person what to do. We just give them information so they can decide what to do. And that's okay. That's you can give a lot of information. Okay. 15 things to know about cost of care. What are your questions about cost of care? You can chat them or uh, you can I have a question here that I'll read out. You can chat them in, or you can unmute yourself and ask. All right. Question says, not sure if I missed it. Will DPA contact us as well, other than the RA messages, to inform us about recipients who have a cost of care amount? If you're a care coordinator, or if you're a residential service waiver services provider, and DPA has updated information about you, they send a letter. Okay. Other service types, I they're not sending letters to other service types, so I don't know what services you're providing. Um, but cost of care, remember, it doesn't apply to personal care, right? So if it's personal care or CFC personal care or CFC, which includes chore and PERS, personal emergency response system, if you're a provider of any of those, cost of care doesn't apply to those providers because it's not an obligation to under those regs for those services, regular Medicaid ones. If you also provide waiver services, then you could possibly collect the cost of care. Okay, go ahead, Cindy.
Hey, Kara and team. So I just wanted to talk really quickly about that last number 15, the working disabled Medicaid. I've been trying to steer a family in that direction. She does have a super high cost of care. She has a trust, dad passed, so she's receiving his money, right? So she's way over things. But now mom, who is guardian, but who wasn't guardian before dad passed. She's really struggling. So I just want to hear you because I talked to the care coordinator, and care coordinator's like, that's not what I do. Like she needs to talk to somebody else. So that's this one. So should mom then just reach out to the case manager at DPA to say, hey,
Yes.
can you help me just
Yeah.
formulate
Give me
where to go?
choices. Yeah, give me choices. The case manager at DPA should be able to do that. They can give people choices about what kinds of Medicaid to apply for and what if they match, if they fit their situation. They can certainly do that. Yeah, a person with working disabled Medicaid, if the person has a job, it's
Yeah.
great because they can have more money in the bank under their own rules. Over 2,000. Everyone thinks of the $2,000 limit for long-term care. They can have that. Other options could be they establish. I don't know what kind of trust they have, but you said a trust, but they could establish more than one trust. They could have an ABLE account and a special needs pooled trust if they wanted to do that. Now, the ABLE account's pretty easy. It's like newer than special needs pooled trusts. Depending on the person's circumstances, like they may not they may not qualify for the ABLE account because it's disability related. But they could qualify for another kind of trust, which is also a pooled trust, but they just call it the Miller's Trust. It's usually used by our elder population. That's Alaska Legal Services can give people advice on that. And also Disability Law Center can help if a person just calls them or the mom or whatever. They can call and they're like an advocate, like an impartial, free advocate for people, and they give information too. So they can call disability law. If they talk to DPA and they're like still stuck and they're like, oh, I didn't understand that, disability law might be able to help. I mean, I'm sure they would. So, yeah. Yeah. What other questions? I hope that helped. Okay, good. There's a comment that says other waiver services providers can ask the client to sign the DPA release of information to get the information sent to them. You are correct, and that's what I was talking about when I said if they have updated information, they can send it to who the person permits to receive it. it's difficult to stay up on that because I mean a lot of times people's residence changes or they change a service provider and they get a new one and everyone's like what's going on, so depending on the form they use, really the client has to the recipient needs to stay on top of who they've given permission to because it's easy to forget and sort of get lost, and then a new provider doesn't know about the cost of care and so forth and so on. But you are correct. So thank you. Okay. Awesome. All right. Let me go back to my agenda here and see if I can't pick up on some of these other key points for you. Agenda. And our agenda. Uh, all right. There's a little quote here of a regulation. I get a lot of questions, although today's session isn't specifically about what I'm going to say. But we often get questions about room and board charges on the heels of like amounts that they charge the person on the heels of the questions about coca. So there's a bit of confusion that comes up over the years regarding regulations that are found in assisted living licensing and regulations that are found in eligibility, meaning, Division of Public Assistance eligibility for Medicaid. So there's this one, acceptance and management of residents' money. This regulation, basically, I'm going to summarize it in a total nutshell, but it says a person in a home, getting services in a licensed assisted living home, if they want the home to manage their money, the home can't manage more than $100 a month. And they have to put it in a separate account and give the person, printout or information about the account and things like that. So, so there's that. That's what it says. And a lot of times I get questions from people saying, "Hey, Kara, I know that we can charge a person all of their benefit income minus $100 for room and board." And I say, well, that's not exactly what it is. This is the regulation that outlines the $100 regulation. It's an assisted living licensing regulation. Now the other one, which is interestingly called personal needs allowance, PNA, is an amount determined in legislature by regulation to be the maximum a person receiving waiver services will will spend on personal needs, and that means room and board. Um, the maximum amount in regulation is 1396, $1,396 for a person living in a facility, meaning home and community-based waiver licensed assisted living home. Um, and the maximum amount for a person living in their own home, whether they own it or rent it, but they're not in the ALH, is 1696 a month for their PNA. Some people, because of their work history, may and other benefit income like retirement income or railroad benefits or something like that, they may receive more than the personal needs allowance. So what they have to do with that overage, and as long as it's, there's a maximum amount for Medicaid, for their form of Medicaid, and then there's the PNA. So their overage, they're going to have to manage that so they stay under the limit for Medicaid. And they could possibly, their maximum amount they can pay for the home is going to be 1396 minus $100 if the home is managing some of their money per this regulation. So there are no regulations that specifically state how much to charge a person for room and board. It really is more about the limit of a person's personal needs allowance, which is in regulation if they're a waiver customer. right? So the personal needs allowance is there to put that, you know, to put that into place. Um, a person may choose to buy extra services from a home if they willingly know about that and it's part of their residential agreement or some kind of an agreement they have in writing. They could do that, but a person should be paying what they can afford, number one, and what's is there equity between themselves and other members of the home and other members of the community for the same thing, for the same kind of physical space and access to common areas and the same kind of, board, which is food and items the home provides for that person. There shouldn't be a huge difference between and amongst people for the same thing. So, like I said, we don't literally regulate room and board, but we do because the person who lives in the home has a limit to what they spend on their room and board. Um, just so you know, people who do not have a work history, which would bring them retirement benefits or other kinds of benefits. Some of our folks have Social Security and they come, like Cindy's example was a person with, well, let's put it this way, a person with intellectual developmental disability may not have the work history that would have brought them high benefit income under a retirement plan from an employer. When people when they're somebody has a disability, a lifelong disability, they have Social Security. It's SSI. It's actually supplemental security income under Social Security. It comes through their parents' account. So a person is has the right to have the higher amount if one parent earned more than the other. And when the parent, if a parent, when the parents die, the higher amount is automatically assigned to that person. So a person will suddenly receive more SSI than they used to in the case of a parent's death because there's rules in Social Security about when parents die and there's SSI income for a disabled child who's now an adult or you know that's what the rules say. So they may have more income and they may you know need to establish a trust or a couple trusts or something like that to work with that. But anyway, this is way far off the topic of cost of care, but we always get questions about it, about room and board and that P&A versus this acceptance and management of residence money. So when they have a COCA, cost of care amount, it's it's always a good idea for the person to write, and if they have a COCA and they live in a home, assisted living home, it's always a good idea for them to write two checks each month, one for the room and board and one for the cost of care amount, because it makes it a lot easier to track. Now, I can't tell people what to do. If they choose not to do that, then, and I can't convince them, right? There's no like regs saying that. I'm just saying like I've taught it since day one of when starting my service at the state. Two checks will help a person track it quite well. So I think that's what I have in terms of cost of care that I can share with you today. Um, Other thoughts or questions about cost of care? I'm looking. I'm reading it. All right, somebody having trouble with CIR training. Okay, maybe if one of my team members can't get you there, then I will get you there. Let me write your name down. Okay, I'll get you there. All right, Joyce. Okay, we'll take care of you.
Thank you.
Yeah,
Hey, Kara, while you're taking care of Joyce, I just have a question
yeah.
because we brought up CIR. So in trying to find the CIR training, and I did find it, but
Uh-huh.
I didn't find that I thought I had done before is I'm the administrator of the organization, and I thought there was a I provide certificates to my staff, but I thought SDS provided a certificate to me. And the training that I took online yesterday, which I got from you folks, it was like a 12-minute training and there's a quiz, but
Yeah.
like it's not going to you. There was no link to send it to you. So it's just like something I could do on my own. Like, how do you know that I did that? And do you know what I mean? Like, I know I did it, but how do you
I
know
can
I
look in there and know. All you have to do is ask
know?
me. Any of our training staff who can go in there and we can see your progress in a class. You should have
Okay.
received a certificate. Either there was like a link to the browser or an email to you. Did you get that or no?
Well,
Okay.
yeah, it was not, it wasn't like it used to, in what I'm remembering, it wasn't like it was in the past where like there was, hey,
Mm-hmm.
I mean, I think I did get something actually that's not true. I think I did get something update afterwards, like thanks for taking
Uh-huh.
it.
Okay.
Maybe that's the thing that I will get a certificate at some point. I mean, I don't need a certificate. I just need to know that you know that I took it.
Yeah, I'll get back with you and you,
Okay.
Joyce, after the session,
All
okay?
right.
I have
Thanks.
both of your questions logged. We can go in there and figure it out, we can give you information. Just SDS training at alaska.gov is the generic any any of us can pick it up, but I got you, okay? So we'll be good. 15 things on coca. Yeah, I will send you that. Yep, everybody's going to get whatever we showed here. I'll send it to you. Question says, can we learn more about the different kinds of trusts and types of Medicaid available for our recipients? Um, right now, today, I, you know, I think that it's better to like prepare something like that. But yeah, the answer is yes, of course. Like we could put together some resources for you, and I could certainly rattle some off, but I don't want to keep us and I want to finish our agenda. You want to know about trusts and types of Medicaid. Yeah, sure. We'll put something together. I can email it to us. I can make a list. I'll ask my team to, help me search some easy things out. I'm sure everybody knows, you know, the main resources. Trusts, like the main resource I think for trusts, if you want to just ask about it, is disability law. But there's basically two kinds. Well, actually three. There's the special needs pooled trust, and it has a bunch of regs attached to it. And then there's the Miller's Trust, which also has regs attached to it. And then there's the ABLE account, which is new to Alaska. And they each have their own advantages and different categories and things like that. But yeah, I'll put together a few resources and send them out. Yep. Okay. Let's talk briefly about the long-term care communication document, and I'm going to find it and bring it up, and I'll share it. So this is going to help if you want to show a person or a family member, you want to help them figure out who to contact at DPA, or if you have you want to contact DPA. This is the latest information that we've gotten from DPA about who to go to for what. Okay, so if you're a care coordinator, there's a lot of care coordinators. It says care coordinators and stakeholders. Stakeholder could be a person, it could be a different provider type, right? So we have it's all listed in order of preferred channel, which they're calling this channel is just the method of communication. So emailing you is using direct secure messaging is number one if you're a care coordinator. Um, I don't think you could, if you're another provider and you want to email them by DSM, I think that's probably okay too. Let's see what the document says. You could email communication via Outlook, which is like a regular email, only for document submission. Okay, so they have it set up so you can upload documents to it. And this is it right here. They're not going to answer it. They're not going to get questions there. They're just going to take in documents there. If somebody wants to contact a caseworker, call the main number, 800 number, 8 to 5, Monday through Friday, and it goes to their voicemail. And they return the call in 3 to 4 days. This is their protocol. Okay. There is a dedicated fax also for document submission. They don't answer questions if you send them, if you write them on a piece of paper and send them to the fax, they won't answer questions like that. It's worked on by date of receipt. Their physical office. There is a website that will tell you where their offices are in different communities in Alaska. This is for dropping off documents, not seeing a caseworker in person. Okay, so if you need to drop off documents, you can do that at the office as well. For case-specific questions, if the person has a caseworker, contact by email, DSM, or voicemail. There is a contact list down at the bottom, and we'll look at that. If they do not have a caseworker assigned, there is a contact for that. If they do not hear from a caseworker after 4 days, there is the contact for all LTC leadership via email, DSM, or voicemail. There is that info down below here. Helpful suggestions. When you're submitting documents, do it in one way only. If you submit documents by all the different ways that have been listed, then it's going to be delayed because they're picking up physical digital documents like from a fax machine. It prints out on a piece of paper. So that's a physical document. But if you're going to send them by different attachments or uploads, they're going to have to put them together and different people pick up those uploads and it's going to take longer than if you just sent it all one way to one place. They have a handy link to their updated forms. Uh, if you have questions and you're about a person or you are the person or a rep, only one person per question. Like if you have questions about multiple people, don't list the multiple people in separate emails. Send one email per person, right? So that they can keep it all straight. They can track it. A current release of information on file or in your document submission, however it is needed to communicate with a care coordinator or any other stakeholder, as the case may be. So here is your contact list, their leadership team, and their caseworkers, right? So, your person probably has one of these folks on their letter if they got one for cost of care, or at least for their eligibility and their outreach and all the things they do. This is who you are going to communicate if you want to talk about changing your Medicaid to a different kind, that type of thing. And we'll send this to you as well. I'm looking at our chatted messages. All right. Thanks for your comments. Appreciate it. All right. We'll attach that with our agenda. And I'm going to go back to that. And I'm going to share it. All right. Um, DPA ROI form. We have talked about that quite a bit. We did distribute to our care coordinator community an updated DPA ROI form that we got through our communication with our IT, and it is the permitted form to use as an ROI form. We have gotten a lot of questions about that particular form from care coordinators. We do not have extra information. We can only redirect you to Division of Public Assistance to confirm, your practice with using a form you're accustomed to using for as an ROI. We've had different communications go out over the years, and there have been different forms that are old forms, some are new forms. Please confirm with DPA what they're looking for and what they need, because these are really DPA processes and not SDS processes. Okay, our info here is really just sort of a repeat. We did talk about this link, so you're here today and you know us, so that's good. Our registration was new for 2025 for this meeting. A provider cannot be reimbursed for any waiver or personal care services if the recipient is physically located outside the United States, and that includes phone calls and distance delivery and things like that. If you have questions specific to your cases, we do have office hours. On Thursdays, we have a care coordinator office hour, which is 8 to 9 a.m., and a provider office hour, which is 3 to 4 p.m. So those are available to you, and I think they might be down at the bottom. Our office, yeah, resources. Okay, so we can talk you through it. Our training is available for providers at our training site. This here, for those of you who have been having trouble accessing training, this is the site to sign up for CIR and things like that. If you have not signed up and established a learner profile, um, two folks who had questions today, I'll just email you separately and include this information too. There's lots of training. We're always building trainings there. We're It really depends on our resources, and we get super busy in the spring, and we will have more trainings coming out towards the late spring and summer. Um, but this is what we're focusing on right now. There's already the cancer screening stuff that's in there, GR training, general relief, habilitation services for habilitative providers. That'll be interesting and cool. Restrictive interventions and applications for PCS admins, how to apply and reapply, what to do, common mistakes, what works, what doesn't work. Our Full Lives Conference registration is open. Full Lives Conference is actually run by the Alaska Training Cooperative, and we support them as you know, a collaborator. And we invite you to register if you have not already, if you want to register for it. It's a pretty great conference. It's lots of fun. It's April 10th and 11th. I think I have their website handy, and we can look at that. Um, Let me grab that. The website for Full Lives. And you can see that it's April 10th and 11th. All sorts of info about it. The theme is building our shared future together. Conference registration is open. If you want to register, they have a link to the form. They have the amount right here, $225. You get breakfast on one day and lunch on the other, and you get snacks throughout the day. Here's our agenda. They have an agenda conference, a conference agenda. I would say if you're registered to check it again, because sometimes there are last minute changes. And the hotel accommodations and parking, you can make a discounted rate reservation if you're traveling and need to stay at the hotel. So we have a great conference planned. I'm super excited about this one. Let me reshare. This is the at a glance conference schedule, and it has there's a little stipulation here, like a little tiny star that says if it's of interest to DSPs. So if you're working with DSPs and they want to know which one to go to, the one with the little star on it. Our keynote speakers are great. Of course, the Outstanding Professionals of the Year award ceremony is super exciting. Commissioner Hedberg is going to facilitate that. I will be your MC throughout the whole conference, so that'll be fun. Keynote is Zach Gottsagen, who is the star of Peanut Butter Falcon. I don't know if you ever saw that movie. If you haven't, you should. It's hilarious and very touching. He'll be there. He's a movie star. Come see him. Then we have some great presentations in the different rooms. You can see there's a civil rights one with Alexander Reuter, who's an advocate with civil lib Alaska civil liberties, the state of civil rights of the disabled in Alaska. So he was great. We had him on an info share, and he was wonderful. Um, Identifying ACEs, which is your early childhood trauma history, I guess is a good way to put it. Strategies for success in designing behavior plans, real life applications of AI, unlocking potential, breaking barriers, building a future without limits with Rick Nelson, who's also a acclaimed author. Um, I highly recommend this year. So, anyway, It's going to be fabulous. So if you want to go, go. Don't stop. Don't pass go without going. If it is of interest to you at all, because you will not be disappointed. Um, and then the rest of it, I have an Alaska Training Cooperative class schedule that came out. Let me see if I can grab that monthly training update from them. I'll share this as well. They have a lot of great, Alaska Training Cooperative has classes that are applicable to a care coordinator, or anyone who works directly with individuals and families, like DSP. So there's core competencies, which is the result of a long, long work that was done many years ago, um, to create foundational training for a DSP or PCA worker or behavioral health care worker or anybody who does direct service. That was developed years ago, and it still stands today. It was very Alaskan, um, and I highly recommend that. They'll have some of these series at Full Lives too. Basic concepts of care coordination is required for anybody who wants to be a care coordinator. One-time attendance to this class. Dementia care skills, three-part series. Here they're delivering it on site in assisted living homes, so that's exciting. And it's about Teepa Snow. I don't know if you know Teepa Snow, but her wonderful positive approach to care is like a strengths-based, reality-based caring course for people experiencing dementia, Alzheimer's disease, and related disorder. So there's that. Hearing voices that are distressing is very immersive, interesting, so that you can sort of get an experience of how people may have intrusive voices, and you get to understand a little bit more in an empathetic way about people who hear voices and what that's like. Here's the good old annual Full Lives. And then coming in the fall, the Disability and Aging Summit, which occurs at the Special Olympics building in Anchorage. Frontline Leadership Institute is fabulous. Um, they do this online. I took this in some of the very, very first ones that they developed, and it really helps if you have your frontline leader, your staff who's supervising DSPs or PCAs or similar care workers. They may have been somebody who was a DSP or a PCA. Now they become the boss of their peers, and that really helped because it helps you grow, and it really helps that new supervisor, get a handle on being a supervisor and how to be great, how to support people to be great. Assistance with self-administration of medication is a required class. They do it. That's the one that we developed, and they're administering it. Um, Fall prevention for direct service, intro to disabilities, ethics and boundaries, documenting Medicaid services, mandatory reporting, supported decision making, what's a waiver, mental health basics. Most of these, except that one that was done in homes, are anytime. And the contact is Liz. Okay, Liz Garkin-Miller, working with the trust. So I will send you this too. I think it's great because you can get your staff trained, and this is all Alaskan, and this is UA, University of Alaska based. SDS training is highly involved with many of these, so you may go to an online training that has a familiar face in it in a recording. Okay, it's coming up to the top of the hour. Does anybody have any questions or anything else they'd like to say or type before we close? Okay, thank you, everybody. I don't see anybody typing in. Look for my email, and we'll get you connected to the training that you needed, the two folks, and we'll get information out. We'll work on something about trust and types of Medicaid. I think it'd be pretty interesting. So, All right. Well, I hope everybody has a great rest of the afternoon. Thank you to my colleagues here at SDS and also to you, our provider group. And yeah, have a great rest of the day and rest of the week. Bye bye for now.
Thank you.
Thanks, everybody.